We've been immersed in post-structural thinking and narrative therapy for a long time and have become interested in new practices to help people with intense experiences. Take, for example, the story of Claudia, who lived with her mom and older brother. They describe Claudia as spunky, playful, caring, and full of life, until the day she became extremely ill and had to be hospitalized for 2 weeks, literally between life and death, and receiving very painful treatments. When Claudia was discharged from the hospital, everyone was relieved, but soon realized that she seemed a very different person. Intolerance and intense frustration got her to scream loudly, kick, bite, isolate herself, and reject conversational attempts daily. Her mother struggled with exhaustion and despair and called for help. As a therapist, how would you work with such an intense situation when talking is limited? Play can certainly be helpful for a while, but is there anything else we can do? Most post-structural approaches rely on verbal exchanges and therapeutic conversations. While this is generally very effective, there are some instances, such as with trauma, where relying on verbal exchanges is not enough. Trauma affects and is expressed by the whole person. Thoughts, feelings, behaviors, embodied sensations are all intertwined in a complex manner. For example, you could not experience intense anger without an increased heart rate and change in cerebral blood flow. Why not include this aspect of experience in therapy? We believe that the most effective therapeutic process for some clients includes engaging with the experience of sensations in the body. We have been drawn to include very specialized forms of mindfulness and embodiment practices when it's relevant, such as with Claudia. There are ways of working with the body that activate the parasympathetic nervous system and allow people to calm the limbic system rather quickly. After such embodied engagement, reflection on personal narrative, dialogues on meanings, and the co-authoring of preferred selves or preferred outcomes can unfold more readily. But including new practices in post-structural approaches in narrative therapy doesn't come without important theoretical considerations. For example, if we occasionally incorporate mindfulness and embodiment practices, can we still call our work narrative? And can therapists remain decentered and influential if they include moments of instructional practices? Or does the involvement of embodied practices represent an extension of what was already done, or is it something new? And is mindfulness just about taking a deep breath, or is it a whole lot more? Are there specialized mindfulness practices that can quickly reset intense reactions? And then, how can we facilitate calming processes with a family? We have discussed these conceptual questions, the unfolding of Claudia's story, and innovative ways of helping people reconnect with their preferred selves in our Family Process article. So what do you think? Can this combination be theoretically consistent and helpful?